Hi, I'm Jared Gardner, and it's a real pleasure for me to be able to present to you at the Wales Pathology Education Symposium. My only regret is that I'm not able to be there in person in Wales with you all, and I have to do this remotely from the USA. Hopefully, one day I'll be able to come to Wales in person and meet everyone. Today, we're going to talk about social media in pathology education. This is something that I spend a great deal of time doing, and it's become a large portion of my professional career. I'm going to talk about some of the different ways I use social media for pathology education. And this is a list of some of those ways, and we're going to mostly focus on teaching and learning via social media today. And also, before we get started, look at the bottom corner. Sorry, I'll go back. At the bottom corner of the slide there, you can see Social Media 101. I've got a guide on my website that tells you all about how to set up Twitter, Facebook, and answers most of the commonly asked questions that I get about social media from pathologists and other doctors. And you can also follow me on Facebook, Twitter, Instagram, Snapchat, all those things. Down in the right-hand corner, you can see my handle. So here's an example of my Facebook page. Now, this is, a lot of you probably have a Facebook account, and that's where you have an account and you send someone a friend request and they accept you or don't accept you, and it's a mutual agreement to be friends. And a lot of times that's for friends and family or people that you know in real life. A Facebook page is different. It's basically like a public website, and you can make posts there on your public page that can be seen by anyone in the world, but they don't see your friends and family. So you create a page within your regular Facebook account, but your page is professional and public. So I use my page, my Jared Gardner MD page, to post pictures like this. A nevoid melanoma. And I post a lot of pathology images and pearls and things there. And that way anyone in the world can learn from that, but they don't necessarily see pictures of my wife and kids and when we go to Disney World or things like that, okay? And it's also nice because it shelters my friends and family from having to see all of these pathology images. You know, they don't always want to see big images of gross pathology specimens of sarcomas and things like that. So my friends and family who like that medical stuff, they can follow my page or like my page, and everyone else can just stay friends with me on my regular Facebook account and look at my pictures of my kids. So it's nice both ways, and it kind of protects your privacy as a physician. A lot of doctors are worried about, how can I use social media? I don't want to have my boundaries, my professional boundaries violated. Well, this is a great way to address that concern. And the other nice thing about it is that, unlike regular Facebook, a Facebook page gives you a lot more analytic information, metrics, based on how many times people saw your post, how many times they liked it or loved it, how many people liked your page or unliked or unfollowed your page. It's important. Those metrics and numbers are just numbers. But for me as an educator, as a teacher, this is the kind of information I want from my students. And basically all the people that follow me online, they're my online students, my online learners. Whatever level they may be at. And so getting this kind of feedback is really helpful. And it's great because Facebook tracks this information, whether or not, it doesn't require anything from those people. They don't have to go and say, oh yeah, Jared Gardner's doing a good job. Facebook can tell me, here's how many people saw your post. Look, down here, 20,000 people saw this picture that I shared of Giardia. And you can see how many people liked it, loved it, all of that. How many people clicked on the post. If you put a link there, you can see how many times people clicked the link to go to a web page. It's really valuable stuff. Twitter has similar things, and I use Twitter and Facebook, and I share very similar, if not identical, content on both, because some people use Facebook and some people use Twitter, and not vice versa. And many people use both, but a lot of people do not. So this allows me to share the same educational content across multiple channels. And so here's an example of bone remodeling, and you can see, look, 91 retweets. A retweet is when someone shares my post on with the rest of their followers, and 161 likes. So a bunch of people like this. Again, that gives me information about how valuable this kind of educational content is to my online learners. And Twitter also has a built-in analytic function, and you can see it will let you look over a longer period of time. So, for example, over this 1 month period, you could see that my tweets had 663,000 impressions. An impression is one tweet view. My tweet being looked at by one person one time. So 600,000 times my tweets were seen. Not necessarily by 600,000 different people, but still, that's pretty impressive over just a month. That's a really broad reach. It's much farther reach than we can get in the traditional classroom setting. Okay, I still teach medical students in a classroom on a regular basis. I co-direct a second-year med student course at my university. I still teach my own residents by sitting at the microscope with them. This doesn't replace my traditional teaching, but it amplifies it and allows me to share content much more broadly than I would ever be able to with traditional techniques. And you can see for each tweet here, this tweet was viewed 5,000 times. 360 people either liked it, replied to it, retweeted it. It's really cool to get that kind of metric data, analytic data about my social media activities. And before anyone asks, I know this question comes up basically every talk I give. What about the ethics? What about patient privacy? Can you share images? Yes, as long as you de-identify the image, it's every bit as legitimate to share a de-identified, fully de-identified pathology image on Twitter or Facebook as it is to publish it as a case report in the medical literature. That's my firm belief based on a lot of different research and thinking about this issue on a basically daily basis. So here's a paper that Eve Crane, my friend Eve Crane, and I wrote for the American Medical Association Journal of Ethics that really delves into the ins and outs of how to protect patient privacy. And I'm working on a much larger paper now that really goes more into the ethical and legal issues surrounding sharing images online. And after doing all that research, I remain firmly convinced that it is both ethical and legal to share images of pathology specimens provided they're de-identified. And sharing images on social media is probably one of the most popular things that pathologists do for education, but also you can share links to peer-reviewed literature. Here's a paper I wrote with my friend Nicole Riddle a couple of years ago, and so I tweeted out a table of different molecular abnormalities in soft tissue tumors that we had in our paper, and I put a link up here to our paper on PubMed. You can see right here, and look, 7,000 times this tweet was seen within, I think this was within like a 1 week period, and this was a couple years ago. I had only I think 4,000 or 5,000 followers at that time, and I have about 15,000 now. And you can see 84 people clicked the link to the PubMed article. Now, that doesn't mean that all of those people read the paper, but all of these people saw that Nicole and I published a paper about soft tissue pathology. So this allows us to take the traditional publications we do and share them more broadly. Again, it allows us to get professional recognition from other colleagues who can see the kind of work that we're doing and accomplishing. And most importantly, when I write something, my goal is that I'm writing something that will be useful for other pathologists, useful in the end for patients. And so if I'm writing something that's helpful and valuable like that, why not share it as broadly as possible so that the most people get the most benefit from it? I also use Facebook for discussion groups, and this was really where I kind of started my social media journey. Back in 2013, I created these 2 discussion groups focused on derm path and on bone and soft tissue sarcoma pathology, which are my 2 subspecialty areas that I'm trained in. And I started these groups as just a way to share a few cases with a small group of friends and colleagues, and people from all over the world joined. And now there's, tens of thousands of members. We have hundreds and hundreds of teaching cases that have been posted here for discussion. And it's been an awesome experience. And this is what was really a major turning point in my career and showed me that people are really hungry for pathology resources on social media. And so this is when I started really applying a lot more time and effort and energy towards doing social media professionally. And I've never looked back since. Here's an example of a post from the bone and soft tissue group. Someone posted a picture of a fatty tumor, and then look what happened. 80 some comments, 84 comments on this, all sorts of discussion back and forth about the ins and outs of diagnosing this kind of a tumor. This is the kind of discussion that we are supposed to have at major pathology conferences or pathology meetings at the national or international level. But as you all probably know, I don't know if it's the same in the UK as it is in the US, but here we often have 30 seconds left over after a presentation, and they'll say, there's time for only one question. And this is a problem, right? At meetings, we have all these great presentations, but we don't really have the luxury of having extra time to discuss the cases and discuss the presentations. Well, here on social media is a great place to have an ongoing discussion. And say some new paper gets published, you can go back and pull up this post from a couple years ago and say, hey, look, a new paper came out, and I bet this is exactly what that entity was that we couldn't figure out 3 years ago. And now it's been described in the literature. So it's this kind of ongoing community discussion and community review, and it's really a lovely way, I think, to learn and to teach and gain experience. I started these groups to teach other people, but I'm sure that I've learned so much more than I've been able to actually teach. And we ended up writing a paper about this. Some colleagues, all of these people run different subspecialty groups on Facebook. And we all got together and wrote a paper about our experiences of doing that. And the cool thing is the authors here are from not just the US, but from Saudi Arabia, Tunisia, Brazil, India. I've only met, I think, two of these people of my co-authors in real life. Only two people. The rest of them are people I've only met online. And yet we published a paper together, and I would count these people as close friends, people I would be happy to have come and stay in my home if they were visiting my city. And to me, that's the beauty of Facebook. The relationships that are developed online are every bit as real life relationships. And here's an example of all the different groups that we had from that paper. And you can read it. It's on the Archives of Pathology, freely available worldwide. And you all know Dr. Phillip McKee, world famous dermatopathologist, wrote one of the major derm path textbooks. And he's also my personal hero because he's an example of someone that, even though he's not at the same generation or level of training as me, he's retired now actually. He embraced social media and uses it with vigor and passion. So he's on Twitter, and he also created his own derm path based Facebook group, which I think just hit its 1-year anniversary and has over 8,000 members. And Dr. McKee personally looks at and comments on almost every single case posted. So if you want to see what Dr. McKee thinks about a weird skin biopsy you have, take some high quality pics, go post them in this group, and he'll usually respond to it. And it's been a wonderful way for me to continue to learn more derm path. And also it's been great for me because I've seen someone who is a senior leader in the field of dermatopathology who is showing that, hey, social media, it doesn't matter what age you are or what career level you're at, social media is a legitimate way to do pathology education. And so I love Dr. McKee for that and really greatly respect him. Path boards is a hashtag. A hashtag is a searchable, clickable label on Twitter. And it's a hashtag that some of my friends came up with, and people have been using it while they're studying for board exams. They'll take a classic image or a pearl of information they've learned while studying for their boards, and they'll put the hashtag pathboards. And then if my residents, for example, are studying for their boards, they can click that little hashtag there, and it will show them all of the other tweets that have pathboards material. So maybe the more classic and really characteristic examples of things that everyone should know before taking an examination. This is a great way to share and teach others while you're studying and learning yourself. And I even have a friend, Christina Arnold, at Ohio State University. She's a wonderful GI pathologist and a really great social media educator. And she gives her own residents and students Twitter homework, has them go look things up on Twitter as part of their actual rotations, which is, I think, awesome. We also have journal clubs that are conducted on Twitter. And so this is something that was started outside of pathology, but we've adopted it in pathology, and we have PathJC, the Pathology Journal Club. And it was even listed on PubMed. PubMed used to keep a list of journal clubs, and we were listed on there. And so we pick an article from the peer-reviewed literature, and once a month at a certain time, we meet, and everyone gets on Twitter at the same time and tweets back and forth and discusses the different points of the article. We'll sometimes have 50, 60, or more people join in the discussion. And I don't know about you guys, but I've never been to a real-life, face-to-face journal club that has 50 people show up. And the nice thing about this is that people all across the country can participate in the USA. And not just the USA. I gave a lecture on social media in Spain last year at the SEAP meeting. And afterwards, a couple of my friends there said, hey, we would love to participate, but this is the middle of the night for us here in the European time zones. So we actually started a Euro time version of PathJC. We'll have our Pathology Journal Club in the US in the evening on a Tuesday, and then the next day on Wednesday evening on European time zone, the same paper will get discussed by a different group of people. And evening on Wednesday is like middle of the day Wednesday for me. So a lot of times I'll still try to take a break out of my work day and chime in and tweet a little bit as well. And so this is a really beautiful way that spans across the ocean even, to allow us to all have discussions about the peer-reviewed literature. And this was just not possible before social media. And we also have one focused on derm path that we started. This is the social media subcommittee of the American Society of Dermatopathology. I'm the chair of that committee. And our group decided together we should start a derm path journal club. And so Sylvia Godesman, who's right there, she put this together, and we've been participating in this for, I think, a year and a half, almost coming up on 2 years, actually. And it's been wonderful for people that are into derm path. And I imagine other subspecialties will potentially follow suit in the future. Now, let me talk a bit about YouTube. YouTube is a great place to share videos of, cats doing funny things and people making fails and all the other stuff. But it's a great venue also for hosting educational video content. And I started a YouTube account back in 2012, and really I made a couple videos and didn't do much more. But about 2 years ago, I really started making videos in earnest, and now I think I have about 50 or 60 videos on my channel. And they're videos of all sorts of things. Here's a video about perineurioma I made recently. I have one about all the basic features of melanoma. I had a thumbnail surgery done recently. I video recorded it and posted there. Why not, right? Someone might learn from that. So if I can teach something, then why not make a video and share it? And the nice thing, again, is that like the other social media platforms, I get analytic data. And you can see that of all the videos I've posted, if you look back over the whole time I've been on YouTube, over 5 years, there's been 1.4 million minutes of video watch time from viewers around the world, from I think 190 different countries, 187,000 views. I mean, it's amazing to see the reach that a video that takes me maybe an hour or two to put together and edit can impact people on the other side of the world for years to come. So this is why I've really started spending a lot more time making YouTube videos, because I think more people really can benefit from this long term and learn. I just basically sit down at my microscope with slides and turn on the video camera and show what I'm looking at, just like I would teach a resident sitting next to me at the scope. And also it allows me to cover basics, like the basics of basal cell carcinoma. That way, every time there's a med student on, I don't have to explain all the basic details again and again every day. My fellow, who's at a higher level, doesn't need to hear those basics. So I can tell the resident, hey, why don't you, after your lunch break, go and watch this video about basal cells, and you can get the basic details that way. And also, again, people leave comments, and so this is feedback. This gives me information as an educator of what people like or what they would like me to improve on. And I've been recognized outside of medicine by traditional media for all the social media work I've done. Getting a little spotlight on a local TV channel may not be that important in the grand scheme of things, but it probably doesn't hurt my standing with my own university when they're getting media requests from traditional media outlets saying, hey, we want to speak to this Dr. Gardner guy who works for you and does all the stuff with Snapchat and Twitter and everything. And so this has been nice. I've been on TV a couple times and radio a few times. I was also featured in an article on NPR on their website, which I thought was a real great honor, and I really loved that. Here with my friend Pembe Oltulu, we're there in Istanbul together. I met her through Twitter and Facebook, and now I consider her a very dear friend. We've written papers together. Again, that's the beauty of social media. And also, I think even though NPR was awesome, BuzzFeed has to be my favorite thing. And I got featured on BuzzFeed. Unbeknownst to me, my students started texting me and saying, Dr. Gardner, you're on BuzzFeed. And it was kind of slightly poking fun at the fact that I couldn't figure out how to use Snapchat. But it was a totally funny piece, and I was really happy to be listed there. So I've also used social media for patient advocacy. And this lady right here, this is Pip. She had a dermatofibrosarcoma on her forehead, a huge scar. And I've spoken and made other videos about this. She's from the UK. But 4 years ago, I joined a DFSP group on Facebook and started volunteering there to answer questions and help educate patients. And I've learned so much from these patients. And really, it's been an amazing, life-changing experience for me. And if you're interested in that, I have a video on my YouTube channel all about how I got involved and what I do with these groups. So you can go and watch that later if you're curious. And in fact, I don't know if you've read this book, The Emperor of All Maladies. I think it's a must-read for every pathologist about the history of cancer and cancer diagnosis and cancer care. But Siddhartha Mukherjee, the author of that book, he actually tweeted about me and about my video. And so I put that right in my CV. I thought this is like the highest moment of my whole career to have Siddhartha Mukherjee tweeting about me. So I thought that was really cool. And it really has been a life-changing experience for me to get to meet these patients and get to know them, not just as an angiosarcoma patient, but as a person with a name and with kids and with hopes and dreams and all of the struggle they go through dealing with their cancer. It has made me, I think, a more passionate physician, a more compassionate and more passionate, driven doctor who's really devoted to trying to help these patients however I can. And this is also on the Archives of Pathology. You can read that. And, the patients have told me, oh, we like having you in our group, but I thought maybe they're just being nice. Do they really like this? So we actually did a survey a couple of years ago with one of my medical students, and we asked a dozen different groups, half of the groups that I was involved in and half that didn't have a pathologist. What do you think about pathologists? Who diagnoses cancer? Your surgeon, your oncologist, your pathologist? Do you like having a pathologist involved in your group? And we, in 3 weeks' time, we got 540 patients and family members. These are people with rare tumors, remember, 540 of them to respond to this survey about pathologists in 3 weeks' time. It cost us $75 via SurveyMonkey. I think the largest cancer centers in the world would have trouble getting this kind of data this quickly. And interestingly, what we found, again, this is on Archives of Pathology. You can read the whole paper if you're interested. But I think, to me, the big take homes is that 90% of the people said that the post made by the pathologist, by me, helped them understand their disease. So I was able to educate not only other doctors, but to educate patients about their own disease. And I think that provides some degree of empowerment to patients that are going through, particularly that are dealing with rare cancers. And so, and when we asked, is it good to have a pathologist in this group, 98% of people agreed and said, yeah. So to me, that was very, very heartwarming to know that it was actually helping these people and that they liked having a pathologist involved. And a majority of them said they would like more pathologists to get involved. So if you have a disease you're interested in, join a Facebook patient group. It will be life-changing. So maybe I've convinced you, okay, social media is a useful teaching tool, but how on earth am I going to convince my department chair, my dean, my university? How am I going to convince the traditional academic community that all this time I'm, quote, wasting on Facebook and Twitter actually matters? Well, I'll show you how I have been doing it, and maybe this will give you some tips. For one thing, I have published a lot of papers about social media or with social media. So I got 89 papers on my CV that I've been a co-author on. 16 of those are actually related to social media, and they're all listed here. And out of the 124 invited lectures and courses that I've given, my 124 invited talks, not counting talks to my own residents or my med students, right, but invited talks, 55 of those are about social media. I started doing that about 4 years ago, so somewhere around 10 or 12 talks per year purely about social media. And I also give courses at the national level at the USCAP and CAP meetings about how pathologists can use social media. So these are things, publications and invited talks, those are things that traditional academia values when you're looking at promotion and tenure. So I'm able to leverage using social media and translate it basically into terms that are more understandable by the traditional academic community. And finally, when I went up for promotion, in the United States, we have instructor, assistant professor, associate professor, and then full professor. And I started in 2012 as an assistant professor at my university. And in 2016, I decided to apply for associate. And when I went up for application, I wanted to find a way to show the promotion committee that all of the time I was spending on social media actually did have some impact and had value. So I surveyed all of my online followers on Instagram, Facebook, and Twitter, and I asked them to rate me based on my social media activity. And then I included the results of that in my promotion application. And I thought I might get, maybe 100 people to respond. But what I wasn't prepared for was that in 4.5 days, I received 1,100 responses from 85 different countries, purely based, responding to my questions about my social media use. And here, this is all the countries. It's amazing. It still blows me away. And I asked people what category are you? A practicing pathologist, a resident, a student, a patient? And you can see a fair number of the people are actually cancer patients or survivors or family members that follow me online. But the most numerous category was actually practicing pathologists. And I asked them to rate my teaching skills. The vast majority said that they thought my teaching was excellent or good. There were 3 people who said it was terrible. I guess you have to have a few haters to make the rest of the data look legitimate. And I also asked people to leave free text comments to explain in their own words how they felt about my social media use. And 1,000 people out of that 1,100 left comments. And the vast majority of them were glowing, really wonderful things. And I submitted a bunch of that along with my promotion application. And I did a keyword analysis to show the kinds of words that people used in their comments. And you can see, again, all these glowing, wonderful words. And while this makes me feel great and feel happy on a personal level, it's definitely about more than ego or more than even just the numbers or the metrics, right? It really matters because this tells me that what I'm doing online has impact on people in the real world. And I don't think it's just about me. I think these kinds of comments and this kind of feedback would be true of any pathologist who uses social media. I just happen to go about trying to quantitate it for the purposes of promotion. And here's some of the examples of the comments that people made, and especially look, this is, I'm a rare cancer patient, and this is Dr. Gardner's the voice for our disease, and I've used one of your posts to make a diagnosis, and I'm an internist. I mean, those things to me are wonderful validation of this kind of non-conventional way that I've been trying to do pathology education over the past few years. And I hope that this helps convince other people that they should be involved in doing this as well. Like I said, impact, real world impact is what matters so much more than metrics. And I think one of the most meaningful data points that I got that tells me that this has impact is in my survey. I asked, have my posts helped you improve your patient care or your ability to diagnose real life patients? And of the doctors who answered that question, I think 670 or so doctors said, yeah, they strongly agree that my posts are helping them care for patients, sick people in real life. If that's not a reason for me to continue to use social media to educate, then I don't know what is. And I hope that it convinces all of you that all of us in pathology should do this. Even if all of us just give a few minutes a day, just a little bit, it could really make a real world impact on our colleagues and on their patients. And that's why I became a doctor in the first place, to help sick people. So if Twitter and Facebook can help me do that better, then I'm going to do it. Whatever we're trying to accomplish as teachers, social media can help us do it bigger, better, and faster. It doesn't replace the traditional modalities of education, but when you combine social media with traditional teaching, it gives explosive exponential power. And I think that this talk hopefully will have convinced you of that. And our students are on social media. This is what they use to get their information. And whether we like that or not, we need to be willing to teach in a way that our students will learn. So thank you again for the opportunity to present to you, and I'd be happy to take any questions now.